contrary to what many eye floater sufferers may think, a vitrectomy is actually a very common procedure. In this video, I'll be explaining what a vitrectomy really is, and also the difference between its normal use and also its use for floaters, also referred to as a floater only vitrectomy or an FOV. I'm optometrist Martin Oguzie, and this is Martin's Eye Tips. Thank you for joining me. We're all about helping you to see better, see more comfortably, and to be less anxious about your eyes. Please think about subscribing to the channel if that sounds interesting to you. And if you do, hit that notification bell as well so you get reminded every time I upload a brand new video. So vitrectomy is a type of eye surgery that involves the removal of part or all of the vitreous humor in the eyeball. Now, the vitreous humor is the jelly-like fluid that fills the central space in the eye and is made up of 99% water. Now, there are several reasons why an eye surgeon may wish to perform a vitrectomy, and most of these reasons are for eye conditions. Now, here are just some of the common eye conditions that may require a vitrectomy: retinal detachment, an epiretinal membrane peel, bleeding inside the eye, or an internal injury or infection. In these cases, the main reason for a vitrectomy is really to clear the way so that the surgeon can see the retinal tear, the hole, or the source of bleeding for treatment. Now, the use of vitrectomy for the treatment of eye floaters is basically the same as it is for any other vitrectomy treatment, except that it may not remove as much of the vitreous humor or even the posterior vitreous, and also the surgery stops after the vitrectomy has been done. Whereas in the case of a standard vitrectomy, the retina treatment then starts once the vitrectomy has been completed. Now, the term FOV is more of a modern term used to describe the use of vitrectomy for simply the removal of floaters only. So what's involved in this FOV vitrectomy? Well, the individual will usually be awake for the procedure, but the eye will be numbed with an anesthetic that removes all pain, but not the sensation of touch. The 3 probes will then be inserted into the eye through a specific region within the eye that we call the pars plana. The pars plana contains no retina, which is helpful for fast recovery and also to reduce any complications. So this is also why you'll commonly hear the procedure being described as a floaters only pars plana vitrectomy. And it's important to make sure that that's actually what you're getting if you are going to have this procedure done. The first probe inserted into the eye allows a fiber optic light to be passed through to illuminate the inside of the eyeball, and the second probe is an infusion probe which allows saline to be injected into the eyeball to replace any vitreous that is removed. The third probe is called a vitrector, and that's there to help chop and cut up some of the vitreous, and also to help suction out and remove the floater along with any vitreous fluid that is needed as well. Now, your surgeon will of course assess your eyes before the procedure and plan out their intended approach to treat your floaters, including how much vitreous they feel is appropriate to remove in order to eliminate the floaters in your eyes. So once they've removed all or as much of your floaters as possible, the procedure is finished. Even though it's a floaters only vitrectomy and not a treatment for retinal detachment, for example, it's likely that your surgeon will create a temporary gas bubble in the eye as a precautionary step to add extra pressure in the eye and to reduce the risk of retinal detachment. So the bubble will disappear all by itself in about a week's time. After this, the probes are removed and the holes created by the 3 probes into the eye should seal by themselves without leaking, and they should completely heal in about 48 hours without any stitches being required. Now, you'll be given some combination, if not all, of the following medications to take home with you. So that includes a painkiller, antibiotic eye drops to prevent infection, steroid eye drops to combat inflammation in the eye, and drops to dilate your pupils, as well as something to lubricate the eyes just to remove any soreness and gritty feeling that you may feel over the coming weeks. So you'll be given and advised to wear a patch over the eye for protection, particularly at night while you're sleeping, and you can expect some discomfort over the first few days in particular, and after a week or so things should settle down significantly, and the improvements should continue to follow in the coming weeks. The gas bubble that I mentioned earlier on will usually be visible in your eye over the first few weeks, and that, with some of the drops that you'll be taking, will leave your eyes feeling less than clear to begin with, and you should find that that quickly improves and settles down as well as the weeks follow on. Now, the vitrectomy is certainly not a trivial procedure. It's also one that is done very regularly by vitreoretinal surgeons in order to be able to make it possible for them to see clearly through the vitreous. For example, if the vitreous is full of blood or debris from inflammation, so that they can then make repairs at the retinal level. Now, the use of vitrectomy for eye floaters is traditionally considered too risky by many medical doctors and even eye care professionals as well. However, when you speak to vitreoretinal surgeons that do this procedure very regularly, they often tell a different story, and many often consider it to be less of a risk, in fact, than having a cataract operation done. I'll be covering more on this next time, so make sure you join me for the next video on vitrectomy, where I'll explain why vitrectomy is perhaps not the big risk that it often is claimed to be, and why it should give all vitreous eye floater sufferers hope for the future. Let me know in the comment section if you've been put off in the past from having a vitrectomy for your eye floaters. I'd love to get your experiences on this, so please let me know in the comment section. Thank you for watching. Please don't forget to like and share this video, and also please subscribe to the channel for more eye care videos and tips like this. Until the next video, I look forward to catching you guys then. Take care.